Hello, my name is Dr. Farman Ali and I'm a GP, family physician. So how do you diagnose blood pressure? Remember, a one-off high reading is not a diagnostic of having blood pressure or hypertension. So when you take your blood pressure, you usually come with two figures. For example, I took my blood pressure earlier today and it was 126 by 77. The top figure is called the systolic, and this is the measure of the pressure inside your arteries when your heart is pumping the blood out. The lower figure, the diastolic pressure as it is called, is the pressure inside your arteries when your heart is relaxing between beats. The third number is the heart rate. It was at 90 beats per minute. It is usually less than that, but maybe I was a bit nervous. As we said, a one-off blood pressure reading that is high does not mean that you have hypertension. Your blood pressure varies throughout the day. It may be high for a short period of time if you are anxious, stress, pain, or if you have been just exercising. For blood pressure to be diagnosed, the blood pressure has to remain persistently above 140 by 90 in clinical settings or 135 over 85 in your home. Now, one of the reasons that many people get high blood pressure in clinics is a term called white coat hypertension. These people become anxious when they attend medical clinics, and hence this should not be labeled as hypertension. For these type of patients, you can have ambulatory blood pressure or home blood pressure monitoring to rule out that it was not a one-off rise in blood pressure. What is ambulatory blood pressure? Ambulatory blood pressure is a small machine that is attached to your arm and takes recordings usually over 24 hours period. As a rule, the average ambulatory blood pressure readings gives the truest account of your blood pressure. If we can't have that for any reason, home ambulatory blood pressure monitoring is a good alternative to that. So what happens in the home blood pressure monitoring? You can monitor your blood pressure and record your blood pressure for 7 consecutive days at your home. Now, on each day, you take 2 blood pressure readings, one in the morning between 6 a.m. and midday, and another one in the evening somewhere between 6 p.m. and midnight, usually 12 hours apart. On each occasion, you will take 2 readings, one after another. Give a minute or so in between these readings. Record these readings on a piece of paper, or you can download the chart from many different websites and drop these readings off to your GP. So once you have dropped off these readings to the GP practice, they will take an average out of the blood pressure readings, and if the average is high, they will contact you to diagnose you with blood pressure. If we go back to the diagram, if your blood pressure is less than 140 by 80, you do not need to do anything. Recheck it in 5 years' time. If the blood pressure is higher than that mark, you may be asked to go and do some home blood pressure monitoring. Again, if it is less than stage 2 hypertension, you do not require treatment unless you have got some underlying health problems. If the blood pressure is more than 180 by 120 on repeated readings in any settings, treatment is commenced straight away. Thank you very much.